All right, I think it's time to get started. Um, I'm sure there'll be a few more people streaming in. I just wanted to say welcome and thank you for joining us today for this webinar on optimizing reimbursement and quality incentives using AI-driven MDS assessments. That's quite a mouthful. So if this is not the webinar you need to be on, then you can dial out. But if this title seems familiar, you are at the right place. My name is Dennis Joseph. I'm the Senior Director of Healthcare Practice at Digital Scientists. Super excited to explore how we have leveraged AI in streamlining MDS assessments and really improving patient care and quality in post-acute care facilities, especially in skilled nursing facilities. Before we jump in, just a few logistics. We'll be running for about 30 minutes or so with time at the end for questions. Please submit your questions through the chat and we'll address them during the Q&A. This session is being recorded and the slides will be shared afterwards. The other big item here is, so this is the beginning of a series of webinars. This first one's going to be an overview of this topic, and then we'll follow this up with deep dives, and we'll show you what those subsequent webinars are and dates for those or timeframes for those webinars. So let's just jump right in. And I want to start off with why we're doing this webinar. So we've been working in this space for several years, and I can tell you we have a lot of scars. In other words, experiences that we wanted to share in terms of leveraging technology and specifically leveraging AI inside of the MDS process. We all know the MDS assessment is essential for reimbursement and quality monitoring. However, they can be time consuming and prone to errors or inconsistencies. So through this topic, we want to show you how you can leverage AI and transform this process, reduce workloads, improve accuracy, and ultimately optimize your reimbursement for the care. So it's reflective of the care that you're providing, and also quality, and finally moving that very important needle, which is patient care. So who are we? So Digital Scientists, we are a technology strategy and delivery firm. We enable healthcare companies to operationalize AI inside of their organization. And what that means is not just coming up with an algorithm or coming up with a software. It's how do you bake that into a company's or an organization's existing workflow, existing technology ecosystem, and how do you make sure everybody's trained to use it right? We look at this or we drive this by doing end-to-end development / innovation of an entire ecosystem. We'd like to not look at technology as individual pieces, but an ecosystem with obviously patients and clinicians at the center. We understand that a lot of these engagements comes with risk and complexity, and we'd like to own and really share that risk and complexity with our clients. And finally, we want to make sure we are staying accountable to the outcomes, whether they are business outcomes or patient outcomes. We want to make sure that we're accountable for both. A lot going on here. We've been doing this for several years, over 17 years, and we understand what it takes, especially inside of healthcare settings that's regulated. Security, privacy comes first and foremost. Making sure that the system that is developed is integrated inside of your ecosystem and it's not a standalone. Making sure that the experience that your clinicians and patients have is seamless. And finally, making sure that the platform is scalable, it performs. You know, as clinicians go out and work with your patients, you want to make sure that the technology is not a hindrance, but it's an enabler. And of course, building on that scalable platform to execute your roadmap. A quick touch on security, privacy. That is absolutely non-negotiable the way we operate. We've been doing this for several years. HIPAA compliance is where our compliance and security efforts start. And we take it to a whole different level to make sure that that compliance, privacy, and security is taken care of and is never an issue. All right. So here's what we're going to cover. We're going to cover a range of topics, starting with the current challenges of MDS assessments as we've seen it. I'm sure you all have your own perspectives on it. And most importantly, where can we leverage technology and specifically AI to potentially transform that MDS process? The role of AI in creating a patient 360. And I'll talk a little bit about patient 360 during this webinar. We will have an entire deep dive on this topic. And to be honest with you, our teams can go on for an entire day talking about this. But a 360-degree view of the patient is central to transforming this process. We'll talk more about that. How do we leverage AI in the day-to-day MDS workflow as your MDS coordinators and nurses are reaching out to patients? How do you bake AI into that? And of course, we'll talk about its impact on quality incentives, reimbursement, patient care, and we'll start talking about a practical guide in terms of how to get started. So really a packed agenda. Before we get into the challenges, and again, I'm preaching to the choir, but just wanted to make sure that everybody has an understanding of what an MDS assessment is. The minimum data set is a comprehensive assessment tool often used in skilled nursing facilities to evaluate the care needs of residents. The outputs of the assessment really helps with care planning, tracking outcomes. It's also a critical factor in determining facility reimbursement, and in short, is really an essential part of resident care and operational management. And so that said, we know that the MDS process is complex, and understanding and implementing a comprehensive tool is going to be difficult, starting with the regulatory and compliance challenges. Facilities must ensure that these assessments are accurate, they are evidence-based, and they're completed on time. Compliance with CMS regulation is key, and any errors or delays in these assessments can really result in penalties or audits, making this a significant challenge for many facilities around the country. To make it even more interesting, the transition from the RUG score system to PDPM adds an added dimension to this. It really shifts how facilities are reimbursed. While the RUG system was based on primarily the amount of therapy that's provided, PDPM really focuses more on patients' clinical needs and conditions. This makes accurate MDS assessments even more critical as they now drive reimbursement based on a broader range of clinical factors and not just therapy usage. Technology and data management play an increasingly important role in making sure these assessments are accurate and timely. The right technology can help streamline these assessments and integrate the data into a larger care plan that your staff can execute. However, managing this data and ensuring that the systems are well integrated into existing workflows really remains a challenge, and in a lot of facilities that we worked with, a significant challenge, especially for facilities who are transitioning from digital systems or lacking advanced technology solutions. The other big challenge is staffing, training, and workflow management. We all know that facilities these days have high staff turnover, and the MDS system is complex and requires continuous training to ensure that staff can handle these assessments properly. Ensuring adequate staffing levels and keeping up with ongoing training needs is critical, as they directly impact both the accuracy of the assessments and overall workflow efficiency. And we'll talk more in terms of how to address these gaps. So the impact of these challenges obviously impacts your quality measures, your outcomes tracking, reimbursement, really far-reaching impacts. And so navigating these complexities of MDS assessments, regulatory compliance, staffing, and data management is key to ensuring quality care and accurate outcomes tracking, and also appropriate reimbursement under the PDPM model. So let's talk about how can AI transform the MDS process. So I want to start defining what AI and ML is. And again, I'll have a deeper sort of debrief into those concepts in one of the subsequent webinars. But artificial intelligence and machine learning, these are technologies that really enable computer software to learn from data, make predictions, automate tasks that typically require human intelligence. In healthcare, AI is transforming care delivery by improving accuracy, streamlining operations, and driving data-driven decision-making, which a lot of your staff members, clinicians, nurses, coordinators, or leaders are making on a day-to-day basis. So specifically in the context of MDS assessments, AI can play a significant role by automating routine tasks, capturing and organizing resident data more efficiently, reducing the administrative burden on MDS nurses and coordinators. It really allows your staff to focus more on resident care, which is what they're really good at and which is what the patients need. It can also enhance accuracy and compliance. By analyzing large volumes of data in real time, it can ensure that the MDS data is accurate, up-to-date, and compliant with regulatory requirements. It can automatically flag inconsistencies, missing information, or potential compliance issues, making the process more reliable, more predictable, and reduce the risk of costly errors or penalties. And we'll walk through some case studies and some very specific examples in one of our deep dives in terms of what it's uncovered and what the teams did to proactively address those issues before the MDS was submitted to CMS. Ultimately, it really helps ensure decision-making and documentation that's data-based and evidence-based. AI-driven systems can really provide clinicians with relevant data-backed insights that align with best practices and clinical guidelines, making sure that the care decisions that they make that truly affect the patients to the core, that those decisions are more robust and really directed towards improving outcomes. All right. So let's talk about how do we integrate AI into your existing systems and workflow. And that's super critical, right? Because your entire staff, your organization is steeped into your specific set of technologies that your staff is using and a specific workflow that your staff is following. And we don't want to disrupt that. And so it's important that however AI is baked into your process, that it's baked into your existing ecosystem and workflow. And it really starts with creating a comprehensive 360-degree view of the patient. In long-term care or post-acute, the complexity of each resident's health profile really makes it essential to have a complete real-time view of their clinical data so that it drives informed care decisions. A 360-degree view not only is clinical, but it also includes the non-clinical, like behavioral health, social determinants of health, functional status, emotional, psychosocial, and any other factors that really influences a patient's well-being. And it's important that your staff understands that 360-degree view. That said, we all know that getting to this holistic view is really challenging. And so, sorry, my computer is running out of charge. Achieving this view is really challenging. And one of the reasons is data is often fragmented with information residing in multiple systems. EHRs, pharmacy systems, lab records, medication systems, and to make it even more complicated, external health agencies. Where AI comes into play is it really plays a pivotal role in aggregating that data from multiple sources and systems and creating a uniform story around that patient. Using AI-driven data integration, these systems can pull together all the relevant patient information into one unified view, starting with the clinical, right? With all of their past chronic conditions that may have dropped off over a period of time and any unresolved acute conditions. What this really helps to do is it creates a single reliable source of truth for care teams to work from. And this ultimately improves their ability to provide targeted, personalized care that drives outcomes for that patient. Beyond just aggregating data, it also helps in integrating clinical, behavioral, and SDOH data, which is the social determinants of health. For example, in addition to capturing medical diagnosis and treatment plans, it can analyze social factors like housing instability or access to transportation, which often have had significant impacts on patient outcomes. We've run into a lot of examples where the condition was discovered ahead of time, but the patient just couldn't get to a facility or a clinician. By bringing these traditionally siloed data points together, AI can give clinicians a more comprehensive understanding of each patient's circumstance, and that really drives decision-making on a day-to-day basis. So a lot of really impactful implications of AI. That said, how do you integrate it into your existing systems and workflow, right? So once the data is aggregated, it can be leveraged to generate actionable insights, to enhance clinical assessments, preliminary diagnosis, coding accuracy, and ultimately treatment plans. It can help identify patterns in patient data that might otherwise be missed, leading to a more accurate clinical assessment process. For example, if a resident's behavior and social data indicates a high risk for depression, it can really assist in highlighting that the next time a clinician goes in and assesses the patient. And after a successful assessment, they can either reject that suggestion, or they can actually appropriately code it into the patient chart. And this leads to obviously more accurate view of the patient, precise diagnosis, and ultimately treatment plans. One of the most powerful applications of AI is the ability to aid in risk stratification and predictive analysis. It can analyze historical and real-time data to predict which residents are most at risk for adverse events. Obviously, the big four comes to mind: readmission, falls, weight loss, and any sort of worsening chronic conditions. This insight allows care teams to prioritize interventions, really allocate resources effectively, and we know resources are limited. So to be able to effectively allocate those limited resources and prevent adverse outcomes as against treat adverse outcomes, you want to get to a point where you're leveraging AI to really prevent adverse outcomes. What we have also used AI for is really analyzing a resident chart based on timelines and the 360-degree view, and really look at patients who have a higher risk of hospitalization for multiple reasons, and really giving clinicians a critical window to act and intervene. So ultimately, the 360-degree clinical view in using AIs, facilities can break this data down across all of these silos, integrate that, and be able to improve your treatment plans, and ultimately drive effective strategies around keeping that patient healthy. Now, all of this technology, all of the analytics, all of the insights is hard to use if it doesn't get served seamlessly inside of your workflow. You don't want clinicians to access one more system, your nurses to add 3 more steps to the process to be able to access those insights. So let's dive into how we can simplify the MDS process for clinical staff. Obviously, we know that the entire MDS assessment process is critical for quality reporting and reimbursement. However, there is a lot of challenges within the existing workflow. It is manual, it is time-consuming, it's prone to errors, prone to inconsistencies. One MDS for that single patient might be different from the previous MDS, which raises a lot of red flags. We also know that your MDS coordinators and nurses are frequently burdened with administrative tasks, trying to balance resident care with accurate and timely assessments. So the evolution of the MDS assessments has led us to seek more efficient solutions, and we've leveraged AI to effectively play that transformative role. Historically, MDS was a completely manual process. However, with leveraging AI, we've automated parts of data collection, We've made the process more streamlined and efficient. By automating those data collection processes, it can gather relevant information from multiple sources that we talked about earlier and feeds that data directly into the MDS process. Even simple decision-making like the ARD dates, I know that drives a lot of impact downstream for each of those patients. How do you make sure that they're looking at all relevant information at the time of admission to be able to determine what the right ARD date should be? And so to be able to surface all of those insights when the decision needs to be made has been critical in driving more efficiencies. One of the most significant benefits of using AI that we've seen is also improving accuracy, consistency, and reducing errors. It can cross-reference data from multiple sources to ensure that the information entered into the MDS is accurate and complete. They flag inconsistencies or missing data. It reduces likelihood of errors, which really impacts both your quality measures and reimbursement. Oftentimes, these inconsistencies are reviewed couple weeks before the MDS needs to be assessed, needs to be submitted, so that the staff has enough time to resolve those inconsistencies before the MDS gets sent out. It can also enhance care quality and improve QI and QMs, quality incentives and quality measures. By indicating trends and patterns in resident data, it can really alert care teams to potential risks or changes in a resident's condition before they become critical. It can monitor changes in mobility, cognition, pain levels, and provides early warnings that trigger early interventions and improves overall resident outcomes and care, minimizes send-outs to hospitals. Obviously, the key to all of this is making sure that whatever AI tool that you're using integrates seamlessly into existing processes and systems used by your coordinators and nurses. It needs to work in harmony with your EHRs and any other clinical systems that your staff accesses. Integrating it into your system and workflow really allows the automation to complement rather than replace the clinical judgment of healthcare professionals. Let me repeat that. Integrating these technologies into your existing ecosystem and workflow really complements rather than replace the clinical judgment. And that's often been a concern, which is, hey, is AI going to take over? No, it doesn't take over because the clinician ultimately owns the decisions that are being made. They're just being given the right insights to make those decisions. All that said, we also know that the success of these AI-driven technologies really needs to be driven by making sure that we train the MDS coordinators and nurses to use these tools effectively. And we'll talk a little bit about what that looks like. So let's talk a little bit about the overall impact of all of this. And some of this, again, is preaching to the choir, right? The impact of MDS assessments on quality incentives, reimbursement, patient care is obviously critical to the running of the post-acute care facilities, especially SNFs. They form the foundation of quality reporting and reimbursement under the PDPM model. So to give you a sense of scale, obviously facilities from around the country submit millions of MDS assessments annually, and CMS uses this data to determine quality incentives and penalties, oftentimes at a state level, obviously directly impacting your financial performance. Inaccuracies or delays in MDS submissions leads to penalties, but also reduces the opportunity for incentives that are linked to quality improvements. So, quality incentives. Obviously, facilities that excel in their quality measures, like reducing hospital readmissions, improving resident mobility, preventing infections, qualify for higher reimbursements. That's great. However, we know that achieving these incentives is deeply tied to the accuracy of MDS data and accuracy or ties to evidence-based information. Without precise assessments, facilities miss these opportunities to reflect the actual care provided, losing out on quality incentives. In contrast, accurate and timely MDS submissions also helps in reducing quality penalties. So we talked about the incentives. The flip side of that are the penalties. Facilities oftentimes struggle with quality measures. They have high rates of falls, pressure ulcers, rehospitalizations. We've run into many facilities where the patients had indwelling catheters where they shouldn't have had one. And that leads to financial penalties. According to recent data, penalties can reduce overall Medicare payments by up to 2%, and I've read that it's a lot higher in some cases. But leveraging AI can really better um, the staff in their ability to identify these inconsistencies and resolve them in time. One of the most direct ways facilities can benefit from MDS improvements is obviously by optimizing reimbursement through PDPM. PDPM shifts reimbursement from a therapy focused to a more model-driven approach by resident needs and clinical complexity. So what that means is accurate coding is now even more important than ever. Facilities that invest in improving the quality and accuracy of their MDS data can ensure that they receive reimbursement that's appropriate to the actual care provided, right? This is not about boosting reimbursement and maximizing it. It's really making sure that these facilities or your facilities are getting reimbursed commensurate to the actual care that's provided. Ultimately, all of this is great. Let's talk about how all of this ties back to patient care. At the end of the day, the goal of improving MDS accuracy, reducing penalties, and optimizing reimbursement is really to improve patient care. Accurate MDS data drives the right care planning and care execution. And it's driven by the true needs of the residents, enabling facilities to offer personalized and effective interventions. Whether it's identifying a resident at risk of falling or optimizing care for a resident with dementia, better the data, better the care. An additional improvement of or benefit of improving MDS process and outcomes is that it enhances a facility's reputation, competitiveness, and trust. Facilities that consistently perform well on quality measures and avoiding penalties really stand out in their community. It boosts not only patient trust, but also referral rates from hospitals and physicians. And that obviously leads to higher occupancy and better financial outcomes. We also know that it impacts your facility's 5-star quality rating, which is a key factor for families choosing these facilities. A high star rating is a signal of quality care, strong clinical outcomes, and financial stability. And obviously, all that is predicated on making sure that your staff is armed with the right technology and insights to be able to do what they need to do to drive patient outcomes. So you might ask, hey, all this is great, Dennis, but how do we get started? How do we put this into practice? I'm showing you one slide, but we're going to have an entire deep dive on this. But let's start the conversation. Let's talk about how skilled nursing facilities or other post-acute care facilities can really get started with leveraging AI to optimize the MDS process. I do want to highlight this by saying AI has a lot of potential to do really positive and drive positive impact. It can automate repetitive tasks, minimize human errors or inconsistencies, really making sure that the assessments are accurate, completed on time, and evidence-based. It can help with predictive insights, which really helps with care planning and risk management. However, it is not a silver bullet. You want to make sure that you're watching the technology and poor implementation. What we've noticed is poor implementation really causes a lot of workflow disruptions and integration issues. And that really upsets staff and really disrupts their day-to-day and really keeps them away from doing what they're really good at. And so planning is essential, planning is critical, and taking a step-by-step process is super important. So the first step is assessing your current workflow. Identify pain points in your existing MDS process. Look at areas where your team really struggles, whether it's the amount of time that it takes, whether it's excessive time spent on data entry, resolving inconsistencies in assessments, missed deadlines, or you may just have a staff that's hired relatively recently or might not have as much experience, and they're taking twice or three times the amount of time that it takes to finish an MDS assessment. Identify those pain points and ensure that whatever platform that you're looking at, it can handle all of these pain points or some of these pain points that are prioritized. Integration is key, right? And so when you're picking the right tool, you want to make sure that it's specifically designed for your environment and modified for your environment. It can handle all of the complex data, all of the insights, but ultimately it's integrated. It must work seamlessly with your current electronic health record and other systems that it integrates with. If it doesn't integrate smoothly, it could create more work rather than saving time. And I'm sure a lot of you can attest to that. So prioritize those tools with robust integration capabilities. Start small. Start small with a pilot program. Implement AI in one department or a specific area like automating assessments or identifying high-risk patients, improving the ARD selection process, filling out some of the forms, or maybe even doing a QI/QM check before submission. This allows you to test the system, the insights that are coming out, and it also allows you to make sure that your staff can effectively read those insights and recommendations and to be able to make the right decisions uh, with that. Training and communication is absolutely essential as we think about this process, right? AI isn't just a new tool, it's a new way of working. Involve your MDS coordinators, MDS nurses from the very beginning. Provide hands-on training, make sure that they understand how AI can make their jobs more efficient, but does not replace them. I think that's the single biggest worry that we had to deal with when we worked with nurses and coordinators. It does not replace them. It really arms them with the right tools to be effective in their assessments. And obviously, throughout this process, make sure there's clear communication and ensure that everybody inside of the organization, all the way up to leadership, is on the same page. So we know that AI can obviously significantly improve MDS accuracy and efficiency, but obviously careful planning, careful execution, starting small, focusing on the right problems is what's going to drive success. All right, I know we are a little over time. I do want to conclude this and do a quick recap. Again, a lot of this we've talked about. Accurate and timely MDS assessments are essential for care planning, for QI/QMs, quality incentives, quality measures, and obviously reimbursement. However, we know that there's a lot of challenges along the way. AI's role in streamlining MDS as it relates to data collection, improving accuracy, ensuring compliance, analyzing large volumes of data, potentially in silos, is where AI can really do the heavy lifting. It really helps reduce administrative burden and allows MDS coordinators and nurses to focus on what they do best, which is patient care. We know that the impact on quality and reimbursement and ultimately care as it relates to improving the quality, reducing quality penalties, optimizing reimbursement, AI can really help with that as long as those decisions are evidence-based. And finally, integration and training is going to be key, right? That drives the implementation. It needs to be integrated into your existing technology ecosystem that represents multiple technologies that your staff is using today, and making sure that your staff is appropriately trained and there's ongoing training so they're really effective in using the insights coming out of AI. All right, this brings us to the end of the webinar. I know I went through this really fast and there was a lot of content. And this was really intended to be the broad brushstroke on this topic that has so many so many levels of insights and depths to it. So speaking of that, as I had mentioned, this is a series. We're starting off with this first one. However, we're going to have 4 additional webinars addressing some of these topics that we covered during this webinar, right? In December, we'll dive deep into creating an evidence-based 360-degree patient profile, all the way from when a resident is first admitted. That's like the biggest challenge that I've heard. Getting that down is super important, and then how do you continue to update that 360-degree profile based on all of the care patterns that the patient exhibits while they're at the facility. So we'll do a deep dive on that. We'll then talk about how to empower staff so that they can make more data-driven decisions, and how do you bake that into the process. Quality incentives and penalties, which is our 4th webinar. I know that's a world in and of itself, and some of it is state-based. And so how do you create the right systems to stay ahead of those updates on a year-to-year basis? And also, how do you make sure that the insights that are being generated is timely enough for your staff to react to and address before MDSs are submitted? So mastering that world is going to be another deep dive. And finally, we will walk through a practical step-by-step guide in terms of how to get started and how to really integrate AI into your existing workflow and technology ecosystem. Included in these deep dives will be a lot of stories from our experience of doing this over the last several years, as well as any feedback any and all feedback that we've heard from nurses and coordinators, who are using these technologies on a day-to-day basis. So once the specific dates are decided, we will be sending out those invites. In case this webinar has led to questions that needs to be addressed more urgently, and you don't want to wait till the scheduled deep dive, feel free to scan this QR code. It's going to lead you to setting up a 30-minute session with me. I may bring in one or two of our experts as well if needed. And if there's a specific situation or a specific scenario that you want us to talk through, I'd be happy to share our learnings and really share our experiences in the space and really help you take the next steps in leveraging AI in your MDS process. Q&A, I know we are running out of time. I do see a few questions, and so I will reach out to those who have submitted those questions individually after this call. But if you think of questions after the webinar is done, feel free to shoot me an email, which leads me to this next slide. That's my contact information. I also have Bob Klein, who's the CEO of Digital Scientists. His contact information is there as well. Feel free to reach out to either of us if you have any questions, or if you want to set up a quick 30 minutes to discuss your specific needs and scenario. With that said, I just want to say thank you for sticking around and joining us for this webinar. And hopefully I will see you all at our next one. Thank you, everybody.